I chose Genesis because I felt I could make a difference here. I feel at larger academic centers, you're just a face in the crowd, where here, your input matters. And I feel I could expand the breast center and make a real difference in the community. So Genesis is a unique place to work in that it has all the state-of-the-art technology that the larger academic centers have, but it's more of an intimate setting. So the medical oncologists, the radiation oncologists, we all meet once a week and talk about our patients. So I think it provides better care for everyone who gets treatment here. In larger centers, they just don't do that. It's just a more intimate setting here, and I feel that the patients can get better care in a smaller hospital when all physicians sit in one room and talk to each other. Whenever I have a patient that comes in with abnormal imaging, and we're quite concerned that it's a malignancy, the radiologist will just jump on the phone and call me and say, "Hey, can you see this patient today?" And the answer is always yes. So I can see the patient the same day, and in fact, sometimes I can send them back and they can get their biopsy done the same day, which makes it a lot easier for the patients. We get our pathology back a lot faster, and it eases the patient's fears as well. So my office is very casual, yet professional. My medical assistants, the receptionists, we all get along. Everyone is very casual and very, very pleasant to any patient that comes in. So we crack jokes. We try to make the environment as light as we possibly can because we know that every patient that comes into my office is nervous, and that's normal. Whenever we get a patient to smile or laugh, it seems to, almost let them exhale a little bit and calm down. Their heart rate tends to drop a little bit. I try to reassure patients that early detection of breast cancer is very treatable. So we can do lumpectomies with very small incisions. And sometimes you don't need chemotherapy, and sometimes you don't need radiation, although some women do. But early detection is the key. So I encourage everyone to come in, get their mammograms, get clinical breast examinations from either their primary care physicians or OBGYNs or myself. I'm happy to do so in my office as well. I see people with breast pain. I see patients that have breast lumps that aren't cancer. I see men in my office that have breast lumps or breast complaints. In addition, I see high-risk patients. So they have a significant family history of breast cancer, and we delve into the family history to see, is there something genetic that is going to predispose them from getting a breast cancer? So there are different screening methods. There are pills that we can give the patients to decrease their risk of getting a breast cancer in the future. And a lot of people don't know that they qualify for these things. I went to medical school at Wright State University in Dayton, Ohio, and then I went on to do my surgical internship at Georgetown University Hospitals in Washington, D.C., and then I finished my surgical residency back in Dayton at Wright State University. Following that, I decided to pursue a fellowship at Akron General University, where I completed my breast surgical oncology fellowship. I'm specifically trained in breast surgery. So I not only care that, yes, I got the cancer, but I also care about what the patient looks like after I'm finished with surgery. So I'm also trained in oncoplasty, which means I use different techniques on my lumpectomies and my mastectomies, so I try to hide my incisions as best I can. So when they look at themselves in the mirror, they don't see their incisions and they don't see that they had surgery. I want to make my patients look as best as I can. Some patients qualify for nipple-sparing mastectomies. So afterward, sometimes I can hide the incisions underneath the fold of their breast or out to the side of their breast. When they look in the mirror, they really don't see their surgical incisions. So I do my part, the mastectomy, and then plastic surgeons that can come help me, they do the reconstructive part, and the women look fabulous afterward.